Hi, I'm Dr. Dana Wasserman, and welcome to Tough Talk with Dr. Dana. Today's tough topic is going to be obsessive-compulsive disorder in the age of COVID-19. But first, of course, what I want you to do is read the disclaimer, and then, as per usual, I'd like you to listen to this important piece of information. I'm legally required to tell you that I'm not providing psychological services and that this isn't intended to treat, diagnose, or cure any psychological issues you may have. I will be sure to honor your questions so that if necessary, you will know better when to seek help. Okay. So today is all about OCD. That's what I'll call obsessive-compulsive disorder. Let me tell you how we'll proceed because this is a pretty heady topic. First, I'll tell you exactly what OCD is and list your symptoms. I'll then discuss common themes among the obsessions and compulsions that make up OCD. I'll discuss famous people and characters who have lived with OCD. Then I'm going to differentiate OCD from a diagnosis called obsessive-compulsive personality disorder, just to shake things up a little bit. Then I'll discuss how OCD may manifest during COVID-19. And then I'll discuss functional consequences of OCD, and we'll have a look at treatment. We're going to do all of this between 15 and 20 minutes, so let's go. What is obsessive-compulsive disorder? Well, obsessive-compulsive disorder is a mental health condition, a mental illness that is characterized by two sets of behaviors, obsessions and compulsions. Let's go over them. Obsessions are defined by repetitive and constant thoughts, urges, or images that are experienced as intrusive and unwanted, that this is not something you want to be thinking about, and that typically cause strong anxiety or distress. So in other words, obsessions are unwanted thoughts that you can't stop thinking about. They make you very upset, and frankly, you want them gone. So he or she attempts to ignore or suppress these thoughts, urges, or images, or he or she tries to neutralize them with some other thought or action, hence the compulsion. What's a compulsion? Compulsions are defined by repetitive behaviors such as hand washing, ordering, or checking, or mental acts such as praying, counting, or repeating words silently that he or she feels driven to perform in response to an obsession or according to rules that are very, very rigid. So the compulsions are behaviors, repetitive behaviors that are enacted in response to these very unpleasant obsessions. Hence, a cycle ensues. These compulsions, these behaviors, serve to reduce anxiety or distress, or with the thought that they may prevent some potentially awful event or situation. However, these behaviors are not connected in any realistic way with what they were designed to neutralize or prevent. That is, that the behaviors that you're engaging in to stop these obsessions aren't realistic, or that these behaviors are very, very excessive. That is, the means to reduce the anxiety are not necessarily realistic and can be way too much. So I'll give you examples in a moment. If these obsessions and compulsions are time-consuming, say that you're spending more than an hour a day dealing with obsessions and compulsions, and if these obsessions and compulsions are causing you clinically significant distress, that they're really, really bothering you, and that they're interfering with your occupational and social functioning, then it's probably time to get looked at in terms of OCD. Interestingly enough, there are common themes of obsessions and compulsions that research has uncovered. Let me go over them with you because they're really interesting. Common themes are contamination obsessions and cleaning compulsions. So cleaning is a very common theme. So you have the obsession of contamination, and in order to neutralize that, you clean and you clean and you clean. Symmetry obsessions and repeating, ordering, and counting compulsions. So you want a particular symmetrical organization of some kind of object, and then you engage in behaviors such as repeating and ordering and counting in order to make them so, but it never is quite enough, and hence another cycle ensues. The final theme is forbidden or taboo thoughts, in which aggressive, sexual, and religious obsessions have their related compulsions. Now, I thought it would be neat to talk about famous people and characters who have had or who have lived with obsessive compulsive disorder. And one of them is the actor slash comedian slash America's Got Talent host, Howie Mandel, who has not only spoken openly about OCD, he's actually written a book about his experiences with OCD and as well ADHD, which will probably be in a later episode. I want to just quote him because I want you to hear the similarity of his subjective experience to the symptoms I have discussed. He says, quote, "When I shake somebody's hand and I feel like I've got something on my hand, there's nothing wrong with going to wash my hand. There's something wrong with being totally consumed that you didn't get everything off your hand, that there are things crawling. So you wash it again. And you're so consumed that you wash it again, and you wash it again, and you wash it again, and you wash it again. When you can't get past that, that's obsessive compulsive disorder. It's not that you're simply afraid of germs. It's that you obsess about that thought and have to do things like hand washing to relieve the worry. I always have intrusive thoughts and rituals." So he clearly has a contamination obsession and a cleaning compulsion that is very, very difficult. In fact, I've seen him on the show give elbow bumps and fist bumps rather than shake people's hands. Now, in terms of TV characters, there was a wonderful show called Monk in the early 2000s, and the detective's lead character, Adrian Monk, lived with obsessive compulsive disorder that seemed to be exacerbated by the rather violent death of his wife, Trudy. And it also served as a catalyst for worsening his condition. He had obsessions about contamination and human contact, and we see throughout the series the impairment in social and occupational functioning throughout, as his obsessions and compulsions interfere in how he relates with his coworkers and the incredibly long periods of time it takes for him to get his work done. However, I will say this, what makes this show so wonderfully unique is that a number of his painstakingly slow and methodical ways of having everything exact and going back and having everything exact are what made him such a fine detective on the show. So I think the writers did an incredibly sensitive job in portraying obsessive compulsive disorder in such a dimensionality. Other people with OCD include soccer star David Beckham, singer Fiona Apple, actress Megan Fox, actor Zach Braff, singer Billy Corgan of the Smashing Pumpkins, and hockey player Clint Malarchuk as well. And they all have spoken out to differing extents about their experiences with obsessive compulsive disorder. Now, just to take a quick step aside, there is a condition called obsessive compulsive personality disorder, okay? This is different. It differs from OCD in that OCPD focuses more on a preoccupation with perfectionism, orderliness, and at the expense of flexibility and efficiency. People with obsessive compulsive personality disorder are preoccupied with details and rules and order. The perfectionism prevents them from getting their work done. They are so into their work that they'll sacrifice relationships and friendships. Morally inflexible, they also have a hard time throwing things out. They have a really difficult time delegating tasks to others, and may be incredibly tight with money. Interestingly, with money, it's been found that they are using money as a way to hoard against catastrophe. And lastly, And most importantly, unlike OCD, there are no true obsessions or compulsions in obsessive compulsive personality disorder. So again, we're talking about a personality type per se. Let's get to COVID-19. For people who live with OCD, they appear to deal with the pandemic in a way that depends on the nature of their condition. That is, how severe or how, well, not severe is their obsessive compulsive disorder. And some research has shown already that for some with OCD, COVID-19 may actually make their symptoms worse, especially if their obsessions are about contamination, getting sick, or the fear of getting others sick. For example, if one lives with OCD, he or she may feel an intense urge to take hand washing guidelines too far, and that more must be better, especially when feeling anxious and uncertain, and we need to sort of relieve that anxiety. In addition, some living with OCD may focus on only a single part of the hygiene guidelines and ignore the rest, such as only focusing on hand washing only, but then ignoring wearing a mask and engaging in physical distancing. And in addition, others are experiencing no change at all, as the worries about COVID-19 are nowhere near intense the worries and the obsessions and the resultant compulsions other people may have. So in terms of COVID-19, I cannot say that there is a cause and effect because, COVID-19 is still going on and research is still happening. But I'm sure that if one were predisposed genetically, temperamentally, biologically, that perhaps one might manifest symptoms. And if you do have any of the symptoms that I have mentioned before, then it can't get hurt to be checked out. Because if you're already experiencing obsessions and compulsions to that extent, you're probably not feeling that great. Let's talk about the functional consequences of obsessive compulsive disorder. OCD is not without its lifelong consequences. It is associated with a reduced quality of life, as well as high levels of social and occupational impairment. So, it does have a big impact on people. The impairment can be seen as simply the time spent on obsessions and subsequent compulsions. Avoiding situations that might trigger obsessions can also impair functioning. Relationships, too, can be deeply affected. Work can be affected because of the time it would be needed to reach a deadline. In fact, even one's health can be affected if going to the doctor or hospital is nearly impossible because of fears of contamination. There are significant real-life, real-time consequences to obsessive compulsive disorder that cannot be overstated. Now, I know that skews towards the negative. However, there are treatments that can be very helpful. And it is not like what I said last week. And it's this. Some people might want to take medication, and if it works for them, great. Some people take the avenue of various therapies, and that might be fantastic for them, great. Other people might use the combination thereof, and that's what works best for them. It is notable that there is some recent research that indicates a combination of medication and therapy is most efficacious. But again, like I said before, you have to figure out what works best for you. And if you work with your provider, and if you do get the appropriate providers in terms of maybe a psychiatrist and a psychologist or a therapist, and you do the work in therapy, you take the medication, and you just have to see what works for you. You might add other modalities as well. I say what works for you is what's best for you. A therapy is particularly interesting to know. It's a kind of cognitive behavioral therapy. It's called exposure and response prevention. Check this out. This modality has people with OCD deliberately confront situations that trigger their obsessive thoughts and fears. So instead of avoiding them, they are guided to confront them head on, hence the exposure. Then one learns to not go through, not to follow through with the compulsions that are typically performed after, that are connected to the obsession, hence the response prevention. And therefore, people will learn over time to tolerate this discomfort and uncertainty associated with not performing the compulsive act. And though therapy and medication can reduce symptoms of OCD, some symptoms for some people may continue to exist. And so it's important to constantly value yourself and work on yourself and look for ways for you to reduce these behaviors so that you become more functional and that you'll be able to reduce your distress and impairment. Also, I want to say that OCD is alive and well in children, and it's simply outside the scope of this talk. But if anybody is interested in learning about obsessive compulsive disorder in children, just hit me up in the comments below, and I'll be happy to direct you to some really good resources. And with that, we'll conclude my talk. Let's see if there are any questions out there. How can one support their friend with OCD? That's a very common question. I think it's important to not judge them and not stigmatize them by utilizing phrases such as, oh God, look at me, I'm so OCD, which is wrong on a plethora of levels. Interestingly, I've read to not enable your friends with OCD. That is, that if they're really scared to drive a certain way or a certain direction, not to enable them, but to simply help comfort them and to help confront their obsessions head on. Not that you have to play therapist, but you don't have to enable them either. And then, do some learning about your friend's OCD so that they feel loved and supported by you. I think that's incredibly important because OCD is such a phenomenally complex psychological condition because you're looking at changes in neuroanatomy, in neurochemistry, and you're looking at genetics and environment as well. There's a huge mishmash of elements that make up OCD. So it can't hurt just to learn a little bit in order to support your friend. Let's see what's next. How can educators help their students with OCD? I think that's probably akin to what I have said before. I certainly wouldn't push them to I wouldn't push them to confront their obsession so much, but what I would do is connect up with their providers as long as there is consent and permission, and then to work together to best support your students and to have the classroom have compassion and empathy, understanding what this particular student is going through. And it's not something to be made fun of, it's just something that is part and parcel to that student. So I'm going to wait a minute and see if there is any other questions because we are almost out of time. I can say with children with OCD, it can occur as early as 5 and 6, and a lot of times they're kind of quiet about it because they know there's something different going on. And as they get older, I think that the obsessions and compulsions become bolder and more noticeable. So I should say that if you do begin to notice that in your child, and definitely take your child to your family provider and see if there's something going on there. It's a very particular set of behaviors, like what Howie Mandel said, you have something on your hands, you wash your hands, and it's not that there are germs, but it's simply that it's the thought that you missed something, that you missed a germ, and you keep going back and keep going back. So what would be the therapy there? The therapy there would be for him to wash his hands once, okay? Wash his hands once, and then to not engage in the compulsion, to continue doing that, because that would be the hard part. It's the repetitiveness and anything to relieve that worry. And what he found was no matter how many times he washed his hands, he never relieved his worry. Well, I have to tell you, it looks like we are out of questions. Let me get it, just 30 more seconds. I'll answer anything. I'll answer anything, even if it's about something that's not OCD, if anyone's interested. Let me see here. Here we go. Can OCD be diagnosed at any age? I believe it's ages between ages 5 and 6 that I've seen. I'd have to do my research about that. How can we work to reduce the stigma around OCD? Like I said before, I think there are a lot of phrases that are really very stigmatizing, such as, oh, you're so OCD, you want everything just perfect, and you just kind of throw the phrase around like it's nothing, and it really minimizes the impact of the condition. I think educating people about what OCD is incredibly important too, especially children. Who may not understand why their friend has to turn off the light switch a certain amount of times every day when he or she enters the classroom. There needs to be an element of understanding and compassion there. Let's see, have there been identical twin studies on OCD? If one twin has been diagnosed with OCD, what are the chances the other twin will have it? Oh, you are lucky to ask that question because I just looked that up before I came on today. And actually there is a significantly greater chance of identical twins having OCD versus fraternal twins. So there is that increase of chance there that identical twins will have it, but it's not exact, and it's not pristine, that there are still identical twins in which one has it and one has not. But twin studies do show that there is a lean towards identical twins having OCD more so than fraternal twins. And let's see, why don't we call this, let's see. What do you say to someone who uses the term OCD in a stigmatized way? Example, ugh, she's so OCD, or I am super OCD about my schoolwork, when they do not have an OCD diagnosis. I won't be too repetitive, but what I would say is to do some gentle education. It's like, OCD is actually a mental illness, and it's not something to just toss aside, that you're not simply OCD. In fact, not at all. But it really minimizes and makes people who do have OCD feel pretty bad, since you're just throwing that term around. Let me tell you a little bit about it. A little education, I think, goes a long way if it's done empathically and without shaming. Let's see. Can OCD be thought of as a strength in trying to stay safe from COVID? Actually, that's interesting too, because I did read something that some people who have OCD are saying, I don't see what the big deal is getting so ramped up about having to beware of physical distancing, and beware having to wear masks, and beware going outside. That this is pretty much the life I live anyhow. So would I call it a strength? I mean, possibly, but then on the other hand, I did discuss before how that for some people, COVID-19 can actually exacerbate symptoms. But for some people who have been in therapy for OCD, for those who deal with the difficulties of tolerating uncertainty and anxiety, I mean, this is their wheelhouse. This is exactly what they're dealing with. So it could be, in fact, seen as a strength for them. What can we do to educate others more about OCD? I would definitely want to educate people more on exactly about the difficulty of the control of the obsessions and the compulsions, and really understanding the nature of them, and why, say, like even in high school, like why you have that friend who has to have everything symmetrical and then is late, to his class for the fourth time, and then having the teacher understand what's going on here. That is not to say we need to enable that behavior, because we don't want to enable that behavior. In fact, that can be a real problem in families in which these particular behaviors, you have the obsessions and then you have the time-consuming compulsions. We don't want to enable them. In fact, we want to gently guide them away from them. But at the same time, too, we also want to understand them. And by understanding them is having an empathy for them. And that comes through gentle education. Let's see. And lastly, when people think of OCD, they often think about someone being obsessive about germs. What other OCD behaviors are there? They're very common. I know of one in which a person leaves home and is convinced he or she left the stove on. So go back all the way home, check the stove is off, check it a couple times, you leave again, and then you're not sure, and then you begin to worry that the stove is still on, and then you go back, and then you leave again, and this turns into an hours-long marathon of not being sure that you left that stove on, when in fact the reality is that you actually turned it off. Let me see what else. Another OCD behavior I would say is maybe counting, something to prevent something catastrophic happening. There was that old saying, when we were kids, step on a crack and you'll break your mother's back. And I thought of that when I first learned about OCD, that if a person might have to do a certain set of behaviors in order to prevent some catastrophic event from happening. And the person becomes convinced that if I don't perform this particular event, whether it's praying, whether it's whispering certain series of words to him or herself, that this catastrophic event will in fact happen. And that's a hard one to unpack, I think, because one feels so responsible for the state of the world in that moment. So let's see, is there anything else? I don't think so. I think that's it. These have been fantastic questions today, and I thank you so very much. And I look forward to speaking to you next week. But first, I must figure out a really good topic to talk about. So until then, I bid you well. And this is Dr. Dana Wasserman. And this has been Tough Talk with Dr. Dana. Thanks so much. Bye-bye.